Good afternoon, everyone. Thank you for joining us for today's webinar. Please excuse the brief delay. We were having just a few technical difficulties, but we're on now. Today's webinar is Smoke-Free Housing, a guide to effective design and implementation strategies. My name is Rachel Logan, the Training and Technical Assistance Manager at the National Center for Health and Public Housing. I am joined today by HUD, the Providence Housing Authority, and the NC Department of Health. At the National Center for Health and Public Housing, we serve health centers who serve low-income populations, and we provide free forms of training and technical assistance, such as today's webinar. Why is smoke-free housing important? Well, smoke-free housing is important because smoking causes health issues that affect low-income individuals, especially because they're exposed to it more often in public housing as well as in other low-income housing developments. It also can cause harmful exposures and can worsen the effects of health issues such as asthma. It's also important because it can contribute to respiratory illness and other chronic conditions that are more prevalent in low-income individuals. Overall, we estimate that 50,000 deaths are attributed to secondhand smoke. So not even you being the primary smoker, but you being exposed to smoking can cause adverse health outcomes. And about 225 public housing authorities across the country have begun implementing non-smoking policies. And today we will feature some of those strategies, techniques, and ways that health centers and housing authorities can partner together to reduce smoking incidents. Today, we are joined by Rachel Riley and Marty Nee from HUD. Rachel Riley currently serves as the Training Manager in the U.S. Department of Housing and Urban Development's Office of Healthy Homes and Lead Hazard Control Program and Standards Division. Her office's initiatives uniquely relate housing to health. She is managing the development of HUD's new Smoke-Free Housing Guidance Manual to be released in fall of 2014. Marty Nee is the Director of the Field Division in the HUD Office of Healthy Homes and Lead Hazard Control. He has served as a member of the Boston Housing Authority's Monitoring Board and as a commissioner on the Boston Fair Housing and Boston Air Quality Commissions. Melissa Sanzaro is the Director of the Special Projects Office for the Providence Housing Authority. Additionally, Melissa is the Project Manager for the PHA's Choice Neighborhood Initiative Planning Grant and the Fire Safety Prevention Program. Anna Stein currently serves as a legal specialist for the Community Transformation Grant Project of the NC Division of Public Health, or North Carolina Division of Public Health, primarily working with the Tobacco Prevention and Control Branch to promote smoke-free policies and multi-unit housing. Ms. Stein also assists with legal issues pertaining to strategies to increase active living, such as the implementation of joint use agreements. I would like to remind all attendees that the webinar will be made available to you after we have this session, and also will be posted to our website in approximately 24 to 48 hours after the webinar ends. Today's objectives are: attendees will be able to explain how smoke-free housing benefits communities. Attendees will also be able to identify key stakeholders that should be included in the transition of smoke-free housing, as well as list strategies to design and implement a successful smoke-free housing plan, describe ways to partner with their local housing authority to offer health services, and also describe smoke-free resources available through HUD programs and initiatives. We have listed resources here for your review after the webinar. Please feel free to use these resources as you begin designing and implementing your own smoke-free housing plan. I will go ahead and turn the webinar over to HUD.
Yes, good afternoon, everybody, and good morning to those of you who are out west. My name is Rachel Riley. I'm sitting here with my colleague, Marty Nee, in Washington, D.C. at the U.S. Department of Housing and Urban Development headquarters. We work in the Office of Lead Hazard Control and Healthy Homes. So smoke-free housing is a very important issue for all of us here at HUD. This presentation that we're going to do this morning, we will be sharing the microphone, and we are going to cover a little bit about the Surgeon General's most recent report on smoking and health, and talk about how that served as background to HUD's Smoke-Free Housing Initiative. The department has 2 administrative notices on smoke-free housing, which we'll talk about a little later. We will talk about some of the challenges in smoke-free housing policies and hopefully explain that none of them are insurmountable, and we're very much strongly encouraging all affordable housing providers to implement smoke-free housing policies. I want to clue you guys in as to what the HUD smoke-free housing toolkits contain and where you can download them. And we want to talk briefly about how we view the role of the health centers in this whole team approach to improving housing and health, and a few words about what our office sees as our future activities. Now, for all of you in the healthcare profession, you understand how important it is when a Surgeon General issues a report. And as part of the 50th anniversary of the Surgeon General's initial report on smoking and health, the SG's office released a new report. This was the 32nd report on tobacco use in the United States. The new report is available at the Surgeon General's website. It's very easy to find. Just Google 50th Anniversary Surgeon General Report on Tobacco. And it covers historical information. It covers information about where we've come, trends in tobacco use over the 50 years, some new findings on the health effects of tobacco use, and some strategies that people can use to end the burden that tobacco places on public health. Now, the report is pretty clear. 2.5 million deaths have occurred among non-smokers who died from exposure to secondhand smoke, and SIDS is also a big concern, sudden infant death syndrome, and complications from other prenatal conditions and pregnancy problems from parental smoking. Another very significant finding in this Surgeon General's report is that 2 cancers have been added to the list of those caused by smoking: liver cancer and colorectal cancer. And colorectal cancer is the 2nd deadliest form of cancer behind lead cancer. So, and as far as the number of deaths annually due to that cancer. And smoking also prevents cancer treatments from working very well. So it's a kind of a double whammy on that side. Now, the Surgeon General's report encourages a call to action, and my department, Housing and Urban Development at the national level, has taken that very much to heart. We have talked about what we can do to improve the health of our residents and also the staff that work in housing developments. And we're working with other federal agencies to eliminate the use of cigarettes, to do what we can to improve the health of people who are smoking, and also the residents who are non-smokers but who live with a smoker, and especially children. So back in 2008, my office organized a session at its National Healthy Homes Conference. I hope some of you are familiar with the Healthy Homes Initiative. We believe that homes should not make people sick, and so we work within the HUD structure and other federal agencies to promote this concept of improving housing conditions, therefore improving resident health. That mostly affects multifamily properties from our perspective, because that's where you have the greatest concentration of residents and things such as common ventilation systems and those types of things. So in 2008, the National Healthy Homes Conference had a smoke-free housing session that was very well received. As a matter of fact, it kind of started us on this whole road. Over the next 2-3 years, our Healthy Homes office here worked with 2 other of the big HUD program offices. One is called the Office of Public and Indian Housing, and the other is the Office of Multifamily Housing. And as you might imagine, they cover different types of housing assistance, but both of those huge program offices, independently of each other and with a little bit of coordination for consistency, developed a notice to their program participants encouraging them to adopt smoke-free policies. In 2012, we released the HUD Smoke-Free Housing Toolkit. There are 2 toolkits, which I'll talk about later on in this presentation. And then last fall, or actually in 2012, we published a Federal Register notice asking people to send us their comments and best practices for implementing smoke-free policy. That is all those things have resulted in a new action guide, which we're working on, and hopefully we can get that out in the fall. And there's a little graphic at the bottom talking about the National Healthy Home Conference. That is going to be week after next, the last week of May in Nashville, and there are at least probably 10 to 12 sessions, a whole track on smoke-free housing. So it's really taken off.
Great. And this is Marty Nee from HUD. I just wanted to, before I get into my piece of the presentation, just wanted to mention a couple of things. One is, in the brief bio that was read before, it wasn't mentioned that I had actually served on a health center board in Boston for over a dozen years and worked primarily as the program committee chair of that health center. And I can tell you I have an incredible appreciation for the work that the health center staffs and the boards do every day to serve the populations that they're serving. And we hope that by going to smoke-free modules and promoting the smoke-free policies, in particularly the some of the poorest residents who will come through your doors on a daily basis, that you'll be able to relieve some of the pressure on your resources as well as improve the health of the people that are seeking assistance from you. And the second thing is, and I think this is a great opportunity to say this, that the number that was reported in 2012 of 225 smoke-free public housing authorities, we've recently done a review nationally of the number of public housing authorities we have with smoke-free policies, and it's up to 490. We are going to surpass 500 this year. It's more than doubled in the time we've been collecting these this data. And one of the interesting things, and one of the points I really want to hit home today, is that all of the PHAs that have adopted this policy since we've put out the guidance, not one of them has returned to a smoking policy. Everybody who adopts this policy finds that it works incredibly well. So your messaging, when you get around to speaking and meeting with either the Public Housing Authority leadership from directly the PHA organization, or maybe even the tenant councils or tenant task forces that you have interactions with, telling people that this is a growing policy, that it's being adopted around the country, that there's certainly a movement behind it, and that you know, nobody who adopts it really ever considers going back to a smoking policy in their apartments, I think is a great sell. So just wanted to mention those two things. But going back to the slides, why smoke-free housing policies now? Well, you know, some of this will be repetitive, but as you've heard, there is no risk-free level of exposure to secondhand smoke. That's from the Surgeon General. Secondhand smoke is a known carcinogen. It migrates between units in multifamily buildings, and smoking is the leading cause of fire deaths in multifamily buildings. This migration between the units in the multifamily building, that's been studied extensively. One of the most significant reports was from a Harvard Public Health School study that was done in, that was published in 2009. That air in 89% of the non-smoking units was contaminated with nicotine. This is in a multifamily public housing development in the city of Boston. Smoke migrates through shared ventilation. It's along air ducts, leaky walls, doorways, electrical lines, plumbing. The you know, one of the pushbacks you'll get from people when you're promoting this policy is, well, you know, why can't people leave me alone in my own apartment to do what I want to do? If I choose to smoke and it's only hurting me, why are you bothering me? Well, the fact of the matter is nobody can smoke inside their unit and just impact themselves. It impacts everybody around you. It impacts the child with asthma 2 floors up. It impacts your neighbor who doesn't want to smell the smoke. It impacts everything around you. There is no self-contained. These public housing units are not hermetically sealed, and you know, there's no way of isolating a single unit's smoker's usage inside their unit. So that's really the messaging that you need to keep in mind when you're talking about smoke and people's ability to enjoy their own homes. It's not just their homes, it's the health of the others around them. And the ASHRAE, folks from the health side are probably not familiar with ASHRAE. That's the American Society of Heating, Refrigeration, and Air Conditioning Engineers. They've determined that the only effective means of eliminating health risks associated with indoor exposure to smoke is to ban smoking entirely within a property. Now, we have numerous studies showing that increased nicotine exposure in children is caused by secondhand smoke. Cotinine is a metabolite of nicotine and serves as a biological marker for nicotine exposure. And well, not to read it all, but just to cut to the chase, the children who live in apartments have 140% higher cotinine level than children living in detached homes. And that's strictly due to smoking in other people's units. That's not due to anything else around them. That's strictly due to the relationship between someone living in a building where there is smoke. And this relationship persists when controlled for poverty, race, ethnicity. This is just something that you know, nobody can come back to you and say, oh, well, that's because this particular population has poorer health habits. That's not the case. This relationship persists when controlled for all of the factors that you can control for. And this next slide just shows cotinine levels in children by housing type. And that figure is showing the mean in households that do not allow smoking in their own home. The highest mean cotinine levels were found in apartments. Attached housing homes were intermediate. That was what color is that?
Red.
That's the red slide in the middle, the red bar in the middle there. And the lowest cotinine levels were found in children in detached homes, obviously where there was no smoke. Over to Rachel. Oh, I'm sorry, I'll do this slide too. Economic benefits of smoke-free housing policies. Well, they've done studies. First off, the turnover costs in an apartment of a smoker are incredibly higher than an apartment with a non-smoker. I've seen estimates as high as $3,000 more cost for turning over the apartment of a smoker than turning over a non-smoker's apartment. You may be replacing carpet. You may be repairing and painting over walls several times. There may be all sorts of furniture issues that are not able to be cured because there's been such a long-term exposure to the smoke inside of the unit. And so on the low end, I see figures somewhere around $1,200 more. On the high end, I've seen figures up to about $3,000 more. When you're talking to someone, you know, obviously as the health center folks, you'll be talking from a health center perspective. But some of the messaging I think you should keep in mind is that there's a economic incentive for people from the health center, from the housing authorities, to take a look at this policy and in a time of very tight budgets, be willing to move to this policy, even though there might be some initial hesitation, but just as a matter of saving money on their maintenance budgets, totally aside from the health of the residents. So I think there's a number of good arguments to make in favor of a smoke-free policy. And now back to Rachel.
Okay. We found that after HUD published its notices, that an increase in public housing authority decisions occurred. And we don't want to take full credit of this. For this, there was a lot of activity going on in the country, a lot of nonprofits, a lot of technical assistance providers, health department folks, and people such as yourselves in the healthcare profession. Everybody seemed to get the message at the same time, and it was a very timely thing for HUD to come out in favor of this. Major big housing authorities across the country are adopting smoke-free policies. So this is not just something that smaller housing providers are starting to do. Marty mentioned the Boston Housing Authority, Seattle, and also King County and Washington State, Detroit Housing Authority, San Antonio, Texas. Some of them are largest, and they have tens of thousands of units in each one of these housing authorities. So they're very, it's really starting to pick up. And you know, many small housing authorities don't find it to be that difficult. They're you know, the cost and the time that they spend in turning over a unit from one resident to a new incoming resident is something that's very meaningful to them and adds up quickly. Okay, so the HUD notices boiled down to two. The HUD Office of Public and Indian Housing, quote, strongly encourages PHAs, which stands for Public Housing Authorities, to implement non-smoking policies in some or all of their public housing units. Now, it doesn't, you know, it does not say you need to do this in only your common areas. It actually does not. We hope that public housing authorities will implement these policies in the units themselves. So it's not just about, it's not about the smoker, it's about the activity of smoking. So what we're not saying is that smokers cannot apply for public housing or they can't live there. What we're saying is that if you have smokers who qualify for public housing, they just need to do that activity in an approved location outside or in a shelter or whatever the specific policy says. And then after the PIH first notice came out, the Office of Housing followed with a similar notice for private housing that receives rental assistance, and they also encourage the smoke-free housing policies. Now, the common themes of these two notices are that HUD was not making this a mandatory policy. That is not the department's position. There's no plan to have this be a requirement at this time or really any time in the near future. We want to continue to have it be a voluntary program. People are signing up to do this. They are finding it beneficial, and as Marty has said, no one's gone back. So they're also seeing health benefits. Residents have testified, and you know, in videos, and Melissa can talk about that. They're very excited. A lot of residents are thrilled that they will have the opportunity to improve their health. One thing that he did mention, that some folks do feel that they should have the right to do what they want within their unit, but Anna Stein, the next speaker, is going to talk about some of the legal aspects, and I'm sure she will cover the fact that there is no real right to smoke in an apartment building when you're you know, dealing with other residents as well. Now, HUD's policy is very clear that the owner or the public housing authority can design its policy to apply some units, certain buildings. They can decide how it's going to be structured, but they cannot deny housing to people because they are smokers, and they must comply with other fair housing laws. That's really key to our policy. And we also encourage public housing authorities to reach out to folks such as you, who are the links for them to provide their residents smoking cessation benefits. And we are advertising the toll-free state quit lines and partnerships between medical providers and state and local health departments to do this. The Public and Indian Housing Guidance also consists of some very good information that we encourage the Public Housing Authority to consult with residents before adopting the policy, that they put it out for comment, that their annual plan to HUD saying what their policies and plans are for the upcoming year should be updated to say that this is what their policy is. They are required to add some language to the lease so that as people re-sign their lease annually, that they have a clear understanding of what the lease says, or in the case of privately owned housing, what the house rules are for that apartment complex, and that these policies be applied fairly and consistently throughout the whole development or the public housing provider. The HUD Smoke-Free Toolkits came out in 2012. There are 2 separate toolkits. They're available on our website, and I believe that you can just actually Google HUD Smoke-Free Toolkits and they pop right up. We primarily used existing materials, but we partnered in the development and the selection of these materials with the American Academy of Pediatrics, the American Lung Association, and the Centers for Disease Control. And we sent out hard copies to thousands of PHAs and 300 resident representatives, because the best way to have this done is not to have it come from the top down in a housing provider, but really to have the residents promote it as well. The toolkits contain some background information, sample documents, some EPA documents, and there is the link to get them. We encourage you all to look at them and actually put them out in your waiting room so people who are sitting there can see what's happening. This is a cover of them. The resident toolkit includes some petitions, some owner letters, some steps that residents can take, and information, especially on asthma. We're very concerned about the rates of asthma and other cardiovascular diseases in these populations, and so the Smoke-Free Housing Toolkit hopefully will give some information.
And I'm going to just mention right there that we're considering adding another letter into the organizing toolkit, just to have a specific letter that could come from health centers to public housing authorities, and this would be either from your medical leadership or possibly from your board chair, whatever organizational structure that you exist in, whatever would be most effective, so that you can weigh in on this issue with some draft language that's common, and we should have that pulled together shortly, and we'll certainly provide it to the organizers of this conference call so that they can distribute it more broadly. Okay, planning and implementation steps. In the planning phase, well, let's even go before the planning phase. What is it that the health centers could be doing to initiate a conversation about this? Well, I just mentioned the letter that could possibly be used from your medical director or from the leadership of your health center over to the housing authority, either to a tenant task force or to the development manager, or possibly a joint letter to them, and to talk about the benefits of going to a smoke-free policy, both from the health side and from the PHA's side. And so that there's a way to begin a conversation. There's also, it's quite likely that the tenant task force president and some of the leadership for the tenant task forces are your patients. They're your customers. And there may be conversations that your health providers can have one-on-one with these folks about going to smoke-free. So there's certainly a public health message that can be delivered at a number of different levels, so that you can move the conversation along. But again, going beyond that, once there's a bite of interest there, going to the planning phase. Certainly, we've always recommended that the PHA do a resident survey. And one of the interesting things on resident surveys is that they very rarely come up with a negative response to going smoke-free. we've seen anywhere from 50% to 75% in favor of adopting smoke-free policies routinely from these surveys. So don't be worried about surveying the residents. You may be very surprised what you get back from them. Now, you've got to also plan for cessation assistance to the residents. This is key, because when you start to talk about these policies in public meetings and people come up and say, listen, I've been a smoker for 40 years, how am I going to get out, get out of this trap that I'm in? Well, you've got to be able to say there will be assistance for you. You may not, not everybody will be able to quit smoking, but there will be assistance for people who want to quit smoking, and it's important to have as part of a implementation policy. You should draft up what would be on the lease addendum in the house rules. How are they going to enforce it? How much, and this is entirely up to the individual public housing authority, what they want to do in terms of making this enforceable and having a consistent policy in place. But there's a wide variety of policies we've seen implemented around the country. So there's no one-size-fits-all for this, and certainly if there's unique aspects of your particular housing development that need to be accounted for, they can be accounted for in your policy, as long as Rachel mentioned, you don't run afoul of the fair housing laws. And the implementation phase, obviously a lot of questions, and I touched on some of those there. Smoking be allowed anywhere on the policy, whether it be smoking shelters, safety, lighting concerns, those types of things. So, I dropped into this next slide. One of the things that we can do to help you, my office directly, is we have HUD Healthy Homes field representatives in the field, in your regions. And if you need assistance with any particular aspect of moving to a smoke-free policy with a PHA, you can contact these people. There'll be information at the end of our presentation. So, they can give you a great deal of assistance on this. Well, the role of the health centers is we've covered that, and I won't try and do too much repetitive stuff. But think about the illnesses you're seeing in your patient populations. Do you have a high rate of childhood asthma? Is the asthma exacerbated by people who's they're either in the homes of smokers or they're getting smoke secondhand from another apartment? Those are the types of things that can inform the letter that you write to the PHA asking them about the policy. Obviously, you need to be thinking about forming a strong and lasting collaboration with your housing providers. I almost think that bullet's unnecessary, because you, as the health center serving that population, you probably have deep relationships and roots with those housing providers. That's probably meant more for a multifamily development that may be not co-located with your own facilities. And then explain to the housing providers that the health centers are there to assist people with problems getting off tobacco use and patients being advised to quit. Again, Rachel mentioned this. Place the information on smoke-free housing in the waiting room. Suggest to patients they recommend a smoke-free housing policy to their housing provider. Get education out there. Find out where the local resources are to assist residents with cessation classes. And then, again, attend public events held by the housing providers as part of a smoke-free housing policy team. Future activities. We are, as a department, and I'm just going to briefly go through this, we're working with HHS and HRSA to explore opportunities to target smoking cessation resources for public housing residents and developments that have adopted smoke-free housing policies. We've been contacted many times by the leadership of HHS, very, very enthusiastically supporting policies and actually wanting us to go further on the policy. So, HHS is particularly engaged with HUD right now on this. We're updating the guidance document for the adoption of smoke-free policies. This is a project that's on Rachel's plate, and we have a estimated time of arrival, fall 2014, for updated adoption of updated guidance for smoke-free policies. And again, we are planning dedicated meetings with housing providers to talk about smoke-free. The Healthy Homes representatives that are in your regions can are all charged with getting out there and promoting this message to the housing authorities. So if they're hearing the message from you at the health side and they're hearing the message from the housing side, through one door or another, the message is going to get through to them. And we're actually establishing a mechanism to track adoption of smoke-free, which is kind of an internal HUD thing. We won't get into that. But one last slide there. There's the folks. These slides will be available to you, so you don't need to scribble down now. But there's the folks and what regions they cover, what states they're in. And with that, Rachel, I think we're done. Thank you very much.
Thank you. We'll go ahead and transfer to Melissa Sanzaro for her presentation.
Okay. Hello, everybody. My name is Melissa Sanzaro. I work in the Providence Housing Authority as the Director of Special Projects Office, and I was also, with one of my colleagues, the project manager for the Providence Housing Authority smoke-free policy. And today I want to lend some insight as to some of the experiences, processes, partnerships, and strategies that we believe are essential when a housing authority is considering a smoking ban or a smoking policy. Just to give you a tiny bit of background, in 2010, the City of Providence was awarded $3.3 million from the CDC, which trickled down through the Community Putting Prevention to Work program and through the Rhode Island Department of Health in order to prevent tobacco with a comprehensive approach with partnerships that involved Providence Community Health Center, the city, as I had mentioned, the Department of Health, multiple community-based organizations, and the PHA was lucky enough to be a partner in that plan in order to implement a smoke-free policy in 5 of our high-rises, which were serving elderly and disabled residents. That was our first phase. Our first phase policy reached 989 units, or more than 1,000 elderly disabled. And following that, we had a no-cost extension of that grant that allowed us to implement our phase 2 smoke-free policy that reached 535 units of family housing and more than 1,400 residents. So with this slideshow, we're going to share with you these objectives here. So here's just a quick overview of the slideshow objectives that will go over with you. Why go smoke-free? Conducting your internal and external reviews in order for housing authorities to prepare for a smoke-free policy approach, some of the essentials for the smoke-free policy implementation, and a review of the successes and challenges that we found. So why go smoke-free is just one slide, and on it, of course, is the first and foremost 2009 HUD letter that encouraged housing authorities to prohibit smoking in their units. And I won't go over this. I think panelists have already went through this, but the preventable public health risks associated with smoking and secondhand smoke are really, really important as housing providers. Fires also really came into play for the housing authority, as smoking is the second cause of residential fires and the #1 cause of fire deaths in the U.S. And then, of course, as someone had mentioned, the reduction of financial burdens that housing authorities are faced with all the time, with unit turnover costs, fire damage and water damage repair, the legal liability of not having a smoke-free policy, and in some cases, housing authorities are able to reduce their insurance premiums with a smoke-free policy. So conducting an internal and external review around your smoke-free policy, I think, is really, before you even begin to try to implement, you really want to get a good understanding of what your internal and external environments look like around a smoke-free policy. And each of these bullet points has its own slides, so we'll go through them. But where are you in the smoke-free world? Where are you in the smoke-free movement? It's important to measure or have a feel for how many other housing authorities in your state have a smoke-free policy. You want to consider how your board feels about a smoke-free policy, where your state and local governments stand with smoking and tobacco use in public places, hospitals, universities, and colleges. Are there health centers in your area that provide the smoking cessation services? And this type of research will really allow you to evaluate your potential partnerships and resources on your approach. And when I say internal review, it's your board, your staff, and knowing your residents. I do want to mention that when the Housing Authority began their research, we had the highest cigarette tax in the U.S. Our restaurants and workplaces were already smoke-free. So, you know, we had a really good position in the smoke-free world. But I did attend a Communities Putting Prevention to Work seminar at the time, and I was really shocked at how many people at that time did not have smoking bans in restaurants. So you really want to just take a look at your external environment, because these factors can have an impact on your approaches and partnership and resources. From a housing provider standpoint, you know, we're here to serve residents and provide them with healthier and safer housing. So whether it's with your partners, your board, and your residents, it is compelling to have a smoke-free policy from a property management and housing provider standpoint. It does make sense to have a smoke-free policy, as secondhand smoke is a group A carcinogen. There's no risk-free level of exposure for smoke-free secondhand smoke. There are no ventilation systems that one can install in order to remove toxins. The percentage of air that's exchanged between multi-dwelling units is amazing. It's 65%. So these are some of the things to consider. Reducing financial burdens, Martin really touched base on it. This was an article, the visual that you see there is from an article from the New England, Smoke-Free Housing New England, that showed that unit turnovers in units where there have been smokers living there can be 3 times more costly than a unit that had a non-smoker there. So it's really important for housing authorities to look at, can they reduce some of their financial burdens associated with unit turnover, as well as fire and water damage. You know, we all track that. And can you save money with your property insurance? The Providence Housing Authority in particular had a very strong fire prevention and safety training program, so we were not allowed a reduction because we had already used up our reduction. But it does give you an opportunity to save money there, and it does reduce the legal liability of not having a smoke-free policy. And I know Anna will talk about that after this. Knowing who you serve is, of course, very important. You should know the demographics, what makes them vulnerable to smoking and secondhand smoke, and of course the related fire hazards. You look at your data and you formulate ideas around your strategy. Are you speaking to pregnant women, families with children? Are you speaking directly with the elderly who are already predisposed to heart and respiratory deficiencies? The elderly also carry oxygen tanks, which are really dangerous. We, 10 years ago, had a death with a smoker and an oxygen tank in one of our developments. Also, the elderly and disabled take a lot of medicine that you know, makes them susceptible to fall asleep a lot, and if they're smoking and they fall asleep, that's a huge fire hazard. You know, you want to prepare yourself as an agency for the upcoming discussion with your residents. Smoke-free policies make sense from both an agency standpoint, but a client's perspective as well. Okay, so once you look at your internal environment and your external environment, these are just some of the essentials that we feel that housing agencies should look at when they want to implement a policy. And I list here 3 planning groups. The bottom where it says partner or grantee meetings, if you are a part of a comprehensive approach to a smoke-free policy and you have worked out that you have plenty of partners, it is important for partners to meet regularly and update each other on not only the policies but the resources available and even the challenges. So I think that's important. I think on the right, the resident leaders and residents, it's hopefully obvious to everyone that you want to engage them in your planning process. And the Smoke-Free Policy Task Force I can speak to now. This I think has to be recommended to all housing authorities. The Smoke-Free Task Force it meets monthly, and it has all of your internal leaders. And it brings years of experiences and resources and viewpoints to your table as you plan your policy. Ours included the executive director, project manager, legal staff, your property management, facilities management, resident services department, your tenant or resident selection staff, security, and then you fold in your partners, your existing partners, sometimes bringing departments, partners as they develop, resident leaders, and even board members if the time is feasible for them. And you meet monthly in order to discuss. It doesn't have to already be developed. The policy doesn't have to be developed for these meetings to happen. We have these meetings happening from, from the very beginning, which I found to be very, very helpful. And then, of course, we go to resident leaders, and this was, really essential. We dedicated a lot of time to our resident leaders and residents as far as, giving them a platform for them to give us some feedback from the beginning to the, implementation of the policy. It really empowered them. Their perspective allows you to formulate a program that's going to work for them. You can almost tailor a program around their concerns. Their feedback, as Martin had mentioned, doesn't have to be 100% positive. Even negative aspects help you formulate your policy. Through discussions, you can educate, inform, and make them aware of so many things regarding smoking cessation, services available to them, details around your policy. So it's really really good to keep resident engagement part of your policy planning at all times. It builds momentum for participation levels. So you have one meeting and there's 12 people, and the next meeting you have to further discuss, you'll find 20 and 25 people because they do want to talk about this issue. And it builds, of course, valuable relationships. A flexible work plan to me is an essential for a smoke-free policy. You want to know if you have funding, if you need funding, if there's potential funding to happen at some point in your policy. You want to know what time period you want to dedicate to your outreach with your residents or even your partners. You want to know how you, to plan that, you want to know how large or small your housing portfolio is. What are your staff resources? Do you have someone that has the legal capabilities to look at the lease and make an addendum, or if grandfathering is the approach you want to take? You want to look at your strong resident relationships and start there. And then the project manager is the most important part because they have to be committed, because you do run it up against even employees that are skeptical about a smoke-free policy. So you want to be flexible in your work plan. Resident surveys are important. We had pre and post surveys, and I just shared with you both of our phases, our pre-survey results. So 83% of the elderly and disabled high-rise residents supported the policy. Of the respondents, 27% of them smoked, and of those smokers, 62% of them wanted to quit. So that was like a really high interest in smoking cessation. In our family pilot, which is our phase 2, we had an even greater level of support at 88%. 34% of the family residents, respondents smoked, and 52% of them wanted to quit. So that was really important when we brought it to the board too. The board, really wanted to know what the residents thought about it, and seeing this really helped them pass the policy at that time. Resident focus groups were kind of like the beginning of the discussion, and they were really important. Most surprising to me was the number of residents did not know that smoke traveled through the walls and pipes and cracks of multifamily dwellings. They started arguments with me. They did not want to hear about this, and I believe it was because the smokers wanted to accept that they had a vice of smoking. They've been smoking for a long time, but they didn't want to take on the responsibility that they could actually be negatively affecting their neighbor. So that was, it was really surprising to me, but that really enhanced our conversation around secondhand smoke, and I believe really moved our support for the smoke-free policy. And it was at this time as well that I noticed that the residents wanted to speak about quitting. They wanted to speak about their experiences of smoking, the cost of their smoking habit. They almost felt trapped, how many times they quit, and they really had an interest in trying to quit again. So that really sent a message to us about the importance of connecting the smoking cessation service to them with our smoke-free policy. It was here we decided that we would go with designated smoking areas. Some smoke-free, public housing authorities go smoke-free campus right away. We did not, and this is where we decided that we would do baby steps here. Many of the elderly and disabled became very interested and concerned about their grandchildren's health. They started to worry about fire safety more, about if their neighbor had an oxygen tank or not. And then as I believe Rachel had mentioned, some residents were there to argue that they had a right to smoke in their apartment. And the good thing about our partnership with the city was we had a sort of unified message that we determined ahead of time, ahead of these conversations, and it was that all residents have the right to breathe clean air, smoke-free air. So a smoke-free policy can give the residents that right. And that message was in our signage, and it was really throughout our whole smoke-free policy. And when I had the one-on-one with our groups, I did say, you know, you want to believe that you have the right to do whatever you want in your apartment. But if you bring it down to the most simplest terms, how about noise level? I asked them, if your neighbor wanted to play loud music until 5 o'clock in the morning every single day, do you think they have the right to do that? Or should they have consideration for their neighbors? And it was almost that type of conversation. So it was really helpful to have that message as well, though, that residents do have the right to breathe clean air. So offering smoking cessation services, as I had mentioned, is also essential. You really want to evaluate the existing community health centers, hospitals, the city Department of Health maybe has programs that offer smoking cessation and even quit lines. Both of the health centers that the PHA had the opportunity to partner with were federally qualified health centers. Some of the things that we considered, we brought the smoking cessation services to our residents. So we had on-site smoking cessation, which was really helpful. A lot of the elderly disabled did not drive. But you might not have that opportunity. So you want to see the locations and distance for the health centers that may have a program that you can partner with. You want to see what their target population that they serve. Are they used to serving a bilingual population? What type of programs do they offer? Is it just sessions? Does it include nicotine replacement therapy? And really, really important barrier was, is the person that you partner with, do they serve the under and uninsured? Because a lot of public housing residents are not insured. So that was a big barrier. Ours did. And of course, funding sources and requirements of the program, you just want to make sure you know if you have the opportunity to partner with somebody, where their funding comes from, what their requirements of their organization is, and to make sure your visions are aligned. Some other things that we considered when we had smoking cessation services was we actually were able to offer smoking cessation services before we rolled out our smoke-free policy. I felt it was really important, but it's not necessary. We thought it was really important to introduce counselors from the health department or from the health centers that you work with to your residents more than one. Through presentations, events, raffles, it gives them an opportunity to meet the residents, to sign up, and to really get on board with the program that increases your participation rates. You want to market their services, lead bilingually and extensively within your community. And you want to track your participation levels with the health centers that you partner with, but just keep in mind the HIPAA regulations. You might not be able to get names and telephone numbers and things like that. You might only be able to get a count from them. This visual shows, the top visual is Tri-Town Community Action, and below was the Providence Community Health Center partners. And this just really shows offering smoking cessation can be challenging with those partnership or funding or location challenges that you may have. Another essential, and I'll go through these really quickly, are effective marketing materials. You want to make sure that the marketing materials that you develop speak to your audience. I knew secondhand smoke was a really big issue in our focus groups, and we just took this fact out and we would put these up in our various spots. I'll go over the marketing outlets with you as well. But it really got to the point in the meat of the matter that secondhand smoke is very, very dangerous and is a health hazard. These are our exterior signage, which is they're bilingual, and right there on the top line, the Providence Housing Authority believes the right to breathe clean air. So that message really was throughout our policy. Smoking doesn't know when you fall asleep. That really speaks to the elderly or disabled that are on medication. It speaks to them for the fire safety. This was another message to our families about the secondhand smoke and how to protect your family from it. We put these up in management offices, frequently asked questions about smoke-free policies. And this was English and Spanish. coming soon flyer. This was to announce the level of support and the buildings that we were going to implement the smoke-free policy. And we had them in poster. We put them in a resident newsletter that went to every single resident. And within it, you can read that we're offering quit smoking program. These are some with the City of Providence marketing pieces that we designed with them. Smoking doesn't need an invitation, which really speaks to the secondhand smoke traveling. And then at the Providence Housing Authority, heat, electricity, and smoke-free air is included. These marketing materials are specific to our smoking cessation program. We did feel it was important to show the faces of our tobacco specialists so that if the elderly and disabled saw them in the building, in the community room, they knew exactly what they were there for. So we marketed them extensively. This is actually a picture of one of our resident commissioners who coincidentally voted against the policy. She's one of our resident board members. And lo and behold, she ended up to be one of our greatest leaders in the smoke-free policy. So that was a really nice story. That's Dolores Casella. So marketing material outlets just gives you a really brief overview of how you can market your material. You know, you can do it through your rent mailers every month, resident letters, newsletters, website and social media we used, presentations and meetings were always ongoing. So you want to be also creative and combine opportunities to bring this information to your residents. We felt it was really important to combine our smoke-free policy with our fire safety program. We have yearly fire safety trainings with large participation levels. So we really developed a really nice presentation that incorporated the smoke-free policy and our fire safety. Any partner meetings, anything to do with health and wellness, you know, it's really easy to group together things. So if you work with your resident service department or your managers and you know that someone's coming to speak about health and wellness, you can always ask, can we bring somebody? Can we hand out a flyer? Can we do a presentation? If you can, with funding, do small raffles. We would even have gift cards that were $5, and people would really appreciate them, to Walmart or to Stop and Shop, to the local market or something. Engagement strategies are essential. You really want to continue to, even if you have a work plan, look at your work plan, see if you can improve it, see if you can add to it, because engagement with not only your residents, with your partners and your stakeholders and your board is really, really important. This timeline we have of both of our phases is in our toolkit that I'll mention, so you'll have more than enough time to look through it if you're interested. And I do think it's important, I'll go back. This timeline was created after the policies were already implemented. Our work plan did not look this way. You know, again, it's fluid and it was flexible, so we did change it. And then this just gives a really quick overview of how we combined our meetings and how many times we reached out and how much you know, outreach and education and awareness we put with not only our smoke-free policy, but education about smoking and secondhand smoke, as well as smoking cessation services. And then we're kind of closing up here, the successes and the challenges. The largest success to me was that our smoke-free policy, we were in the beginning of the public housing smoke-free movement, so I consider us pioneers because it was really scary to do, not having a template or a best practices. But it really is the beginning of social change. You know, since we implemented our policy in 2011, I believe we had 6 Rhode Island housing authorities, 6 cities that had smoke-free policies. And now I think we're up to 23. I think only 1 of our cities doesn't have a smoke-free policy. So that's quite an accomplishment. You know, when you have residents that say, I'm going to move from here because I want to go smoke. I don't know where they're going to move to and be able to smoke. So that was, you know, a success to me. The education and awareness, you know, when you can educate and make your residents aware of modern day trends specific to their health, you know, we believe that that is a success. The task force to me built teamwork and leadership among our staff and unified, I believe, our staff and prepared them well for the policy. Comprehensive approach with the city and other agencies. Really, it was you know, we already had really great existing partnerships, but it really built camaraderie with us. And the over 100 residents who participated in smoking cessation, that was also a success. It enhanced our fire safety and health training. And then I believe the other thing that we funded with the smoke-free policy was a smoke-free documentary, which helps us, just like this presentation, reach beyond the City of Providence and beyond the Providence Housing Authority and try to really get out the word for smoke-free policies in public housing. We even do private housing presentations. This is just a quick look at a newsletter that we highlighted not only our residents, but the middle picture is a picture of one of our employees who also participated in smoking cessation when she had a son. And then this is a really quick look at, and you'll have availability to this flyer. We created not only the smoke-free documentary, which is on YouTube and our website, but we also did a toolkit just specific to our experiences, so our marketing pieces and our legal documents specific to our lease are there, and meeting minutes for our task force meetings, slideshows, and everything can be found there. And then our challenges. Enforcement and eviction for those who smoke, who go against the policy, the violators. It seems extreme to most when you say that you're going to evict somebody for smoking. And, you know, as public housing authorities, we're in the business to house people and not evict them. So, you know, you want to just send a message with your policy, and you have to formulate your enforcement as you see fit. You know, you wait for violations to come in, you address them sometimes with the discussion. We do have a fine system, and to date we've never evicted anybody for smoking. We do know of one case in Rhode Island, I believe in Warwick, that did evict somebody, but I do believe that the smoking led to fires in those cases, so it put other residents in danger. Board approval was challenging for us. We had 3 resident commissioners, all 3 of them smoked, and it was a close vote. We did get it, but it was a challenge, so you want to prepare yourself with that internal and external scanning. Tracking is tough for smoking violations, because here at the Providence Housing Authority, we're the largest city in Rhode Island, and for us, and I'm sure as for many other housing authorities, violations of other more important things like boarders and lodgers and drugs and crimes, you know, they take priority in the housing authority. So property management staff is inundated with things like that and keeping their residents safe in other ways. So, you know, you want to make sure you're sending a message, but where it falls in your priority has to be something that you must consider. Keeping smoking cessation resources within our community was a challenge for us. You know, funding's running out, and we don't serve them on site anymore. But we still work with the Department of Health, and we still work with qualified health centers all the time, and are always developing little pilot programs at sites. They do go on. We've provided spaces for the entire state to be served at our site, and we wish we could do more. So I know it's probably a struggle for everybody there who's trying to get some of those programs, sustain those programs, not just offer them for a short amount of time. Quitting smoking does take a long time. Outreach participation levels can be challenging in public housing communities across the nation, so I won't get into that, but that can be tough if you don't have the funds for raffles or events and things of that nature. If you do decide to go with designated smoking areas, the cost of designated smoking areas can be costly. We found that in our high-rises, you only needed 1 or 2 benches with a signage. That wasn't that expensive. But on our family developments, where you have 475 units across 5 to 7 acres, that can be pretty costly to space around benches and ashtray urns and signage. So that can be a challenge. And of course, the typical housing authority staff resources can be limited. And then my last slide, I kind of, when you look at it, it kind of takes what I said and it puts it in three categories. When you initiate, what you do. When you're planning, you know, some of the things that I spoke to, and then actually executing it as well. I do want to just mention that I have so much more information. I have limited time, but I do have much more information about the implementation of it and some of the steps. And if anybody is interested, they can surely contact me. And that's Marcella in the end. She's the project manager for our family site. And that's it.
Thank you, Melissa. We'll go ahead and pass the presentation over to Anna.
Thank you. And I'm going to try to go through my slides pretty quickly so that we'll have time for questions at the end. So I'm a legal specialist with the Community Transformation Grant Project of the North Carolina Division of Public Health. The CTG project is funded by the Centers for Disease Control and Prevention. So I'm going to touch real quickly on the legal issues, and as was said before, there's no constitutional protection for smokers. They're not a protected class. Smoking is not a fundamental right. So if smoking is going to get any sort of protection, it's going to have to be from some sort of statute, whether federal or state. But there are no federal statutes that would protect smoking in housing, and there's no state statutes that I'm aware of that would protect smoking in housing. So basically, in every state in the country, landlords can voluntarily implement smoke-free policies and not run into any legal issues with that. In most states, municipalities do have the authority to ban smoking in multi-unit housing, and this has been done in a dozen or so municipalities in California. Here in North Carolina, our state legislature has preempted our municipalities from doing that sort of thing, so we're not allowed to pass those sort of bans. But you know, things tend to spread east from California, so we might be seeing other municipalities doing this too in the future. And that wouldn't just be public housing, but all types of multi-unit housing. So potential liability issues for landlords, there have been some cases reported in various states where landlords have been sued for various common law actions like implied warranty of habitability, constructive eviction, negligence, and there have been some successful suits over that. I expect that as there's more of an expectation on the part of residents that they're going to have clean air in their units, we will see more suits over this. And also, certainly the Fair Housing Act is coming into play a lot. All of the housing providers that I talk to say that they are getting reasonable accommodation requests from people to be moved to different units because their neighbor is smoking, and I do think that this is a frequent motivator for housing operators to take their property smoke-free because they get so many of these reasonable accommodation requests. So I wanted to make you aware of a couple of brochures that have been put out by Change Lab Solutions, which is a public housing law, a public health law think tank in California, and they put out a lot of great material on smoke-free housing, and they have two legal brochures that are written from a California perspective, but the law is really the same from state to state because we're dealing with a lot of common law that's the same and then federal law that will be the same also. So if you have patients that you're working with that are suffering from secondhand smoke exposure, I recommend that you share with them these legal brochures that you can find online from Change Labs. And then the second one I wanted to show you from Change Labs just talks about how people can use the Fair Housing Act to request a reasonable accommodation from their housing provider if they're getting exposed to secondhand smoke. So I want to talk a little bit about smoke-free housing activity in North Carolina to give you an idea of what could be happening at a state health department level and to tell you about how you can connect with state health departments in your state who might be doing smoke-free housing work. So first of all, we have a smoke-free housing website that has resources for managers and tenants, and it has some really great things in the resources section, like the sample document section of that. We have timelines, sample lease addendums, sample tenant surveys, so we're happy about our website. So some of the things that we've been doing here in North Carolina is we give presentations at all of the statewide housing conferences that go on for affordable housing and public housing and market rate housing. And we also give lunch and learns in different counties around the state for property managers, and we try to have panels where we bring in housing managers that have already implemented the policy so that folks can hear from them instead of from us. With the public health people, we try to talk as little as possible and let the housing operators do most of the talking. And then another really important thing we do is provide assistance to the management companies which are taking their properties smoke-free. So the forms that takes is we help conduct the resident surveys, which have been talked about earlier and are absolutely essential to get that resident input, and we also have helped provide information sessions to residents on the health impacts of smoking and secondhand smoke, and we provide resources to help the residents quit smoking. And I see this as a really an important potential opportunity for health centers to get involved in smoke-free housing, to help with these resident meetings, and to provide that health perspective on why these policies are so important. And of course, you would be so essential to helping provide the cessation resources. So this is a resident brochure that we developed for Partnership Property Management is the largest affordable housing management company in North Carolina. They took all of their properties smoke-free beginning January 1st of this year, which was almost 200 properties just in North Carolina alone. And we worked with them to develop a resident brochure that they handed out to all their residents to explain why they're going smoke-free. We have different versions of the brochure with different resident photos and quotes from residents. And really importantly, we have the quit line resources on the back, and we saved space for local programs to add their cessation opportunities as well. And then that's on our smoke-free housing website as a Word document so that it can be usable by any housing operators in the state. And I wanted just to tell you a little bit about some research we've done. We surveyed all of the public housing authorities in North Carolina, which is approximately 93 of them. We still have a really low number in North Carolina that are smoke-free. So as of that time, we had four housing authorities that had at least one smoke-free property. We're now up to 6 housing authorities with at least one smoke-free property, with 2 of our housing authorities completely smoke-free. But we're having more movement all the time. With affordable housing, we have a lot more smoke-free properties. So we conducted a survey last summer. We surveyed every affordable housing property in the state, which was 1,865 properties. We got a 57% response rate, and here are the results. So I think the most interesting column here is the one where it says not allowed, smoking is not allowed in any of these places. So if you look, the top row is indoor common areas. So the highest percentage did not allow smoking in any indoor common areas. That's almost 70%. That's very common. But if you look down to the bottom, that 16.5%, that was the percentage of residential units that had a smoke-free policy. That's a pretty low number, but I'm really happy to say that because we had our largest property management company go smoke-free this year, and another large management company did as well, that we recalculated these numbers, and we are now up to 28% in the state in just 1 year. So we've had a big jump in our affordable housing smoke-free units. So other key findings from this affordable housing survey were that turnover costs were higher in units where smoking is allowed. That wasn't a big surprise. One thing that we really wanted to investigate was the number of evictions that are occurring. We were also, as Melissa was talking about, that's, we don't want to be evicting people. We did find that they were rare. We were finding that there were some evictions. There were 5 evictions in the state of North Carolina that had occurred due to violations of smoke-free policies out of, that was representing 16,168 smoke-free units. So there were a total of 5 evictions, and they were all granted by the magistrate. So I think some folks are worried that magistrates will not enforce the smoke-free policies, but that is not what we were finding. They are enforcing the smoke-free policies. Another really important thing we found was that there was no difference in occupancy rates between the smoking allowed and smoke-free properties. We find that people are worried that if they pass a smoke-free policy, people are going to leave. We didn't find that. And we also found that the majority of the folks reported that staff time spent on smoking issues was the same or reduced after the smoke-free policy went into place. So some resources that I want to go over with you. There is a global directory of smoke-free multi-unit housing programs, and you can check that out online. And I encourage you to find out whether in your state there is a smoke-free housing program that's already active, and you can get in touch with them and work with them. Also, I want to lead you to the Tobacco Control Network. That is a consortium of all of the state health department tobacco control programs in the country. And so if your state is not listed in that global smoke-free program directory, go ahead and call the tobacco control branch for your state and see what they have going on with smoke-free housing, because they already might have some activities that you could link with. And if they haven't started working on it, they might want to start if they find that interest from you. Another thing I wanted to point out was that Live Smoke Free, which is an organization out of Minnesota, they have a great webinar series for public health professionals that I would highly recommend that you watch if you want to learn even more about smoke-free housing after today. And then I wanted to plug the Smoke-Free Housing Toolkit from HUD, of course. And finally, I just want to end on a positive note. This is Mary. She was from one of the partnership property management properties that went smoke-free at the beginning of this year. When we first visited her property and we're talking to some folks about the policy, she was the resident that was most vocal, opposed to the policy. She was very upset. She said that she felt like, you know, that this was really a violation of her rights. She'd been smoking for 62 years. We went back 2 years later and we're taking resident photos, and she wanted to be on a resident flyer promoting the smoke-free policy. She had had a complete change of heart. She had joined a smoking cessation class that the local health department was putting on at her site because of the smoke-free policy, and she was just, she had a new lease on life, and she was very excited to try to quit smoking again. So I just want to say this is why we're doing what we're doing, and there's more information. You can, please feel free to contact me, and that's it. Thanks.
Thank you so much to all of our presenters today. It was just an excellent webinar all around. I really appreciate each of you sharing your perspective and how we can connect the federal, state, and local levels in this effort to end smoking in public housing as well as in multi-unit housing. So we'll go ahead and open up for Q&A. And for anyone who would like to pose a question to our panelists, please use your toolbox to type in your question, and I'll forward it over to our presenters. Sorry. So I just have a few announcements before we open up for Q&A. Please feel free to visit our website. This is where you'll find archived webinars, including this one, shortly after the webinar is over, as well as information about training, fact sheets for residents and even providers, as well as ways to connect with us through our mailing list. And so this is what you'll receive if you sign up for our mailing list: HRSA updates, as well as information on our upcoming webinars, funding opportunities, and other pertinent information. Also, follow us on Twitter. We have a new hashtag that we have going for our upcoming symposium, which I will describe later. And we also have a YouTube channel which you can connect with and subscribe to, so you'll be aware of any new videos that we add, which are generally webinars, but we also will be recording from our upcoming symposium, and we'll post those videos there if you're not able to attend. So for the 2014 Health Center and Public Housing National Symposium, we'll be having that in Alexandria, Virginia, June 10th through 12th, and that'll feature a lot of key national, federal, state, and local speakers, as well as workshop sessions on various topics related to health center management, program development and analysis, as well as performance improvement. So you don't want to miss it. Please register, and you can use that link at the top. Also, we have a webinar that you can view if you're not sure what to expect at the upcoming symposium, where we featured 2 past attendees who were able to describe how important the symposium is. And of course, feel free to contact any of us for information, assistance in any way, as well as ways to maybe connect with our panelists. So we'll go ahead and open up the Q&A. First question: what financial incentives are available to PHAs? So I think this is more of a question for HUD, unless, Anna, you're able to answer from a state perspective.
I'm not aware of any. I do think that's a HUD question.
Okay.
I'm sorry, could you repeat the question?
The question is, what financial incentives are available to PHAs to implement smoke-free housing?
Well, from our perspective, the financial incentive is the reduced cost in the unit turnovers. That can be a significant financial incentive for the housing authorities to implement the policy. And that can run anywhere from, as I said, $1,000 to over $3,000 per unit turnover.
Yeah, that is a pretty good cost savings, as you said, per unit. And then I believe this question is for Melissa. What was the exact role of FQHCs in your implementation plan?
Is that the federally qualified health centers?
Correct.
Yes. What role do they handle? Is that what?
Yes.
Yes. They provided the smoking cessation and nicotine replacement therapy sessions. Through grant funding, they had to serve a particular number, and they happened to, with our work plan, come to our sites on site once a week for 3 10-week sessions. The residents did have to participate in the counseling sessions in order to receive their nicotine replacement therapy, which included lozenges, gum, and patches.
Okay, great. Are there, and I think this is just a general question for anyone who's able to answer, are there any multicultural materials available to promote smoke-free housing?
I mean, in my research, I found plenty. You know, you can go on Google, and you can find plenty of multicultural messages, or you can tailor your own if you like one that you see, and you know, you can get an image of your own resident or group of residents and do your own. And if you wanted to use ours as a template, we really tried to speak to the multicultural populations.
Okay. Does anyone else have any additional information on resources or multicultural resources? Yeah, okay. And then which partners, I believe this is from Melissa, which partners did you include in planning your smoke-free housing program?
The City of Providence, specifically the Mayor's Substance Abuse Prevention Council. So the City of Providence has their own committee that meets for substance abuse. So they were the lead at the city. The Department of Health has a tobacco program, so they had a coordinator there. The federally qualified health centers, of course, we had 2 of them. We had a Data Corp, was a data collection agency that the city hired through the grant in order to monitor grant activities, because each of the partners had different roles in the citywide tobacco-free campaign. So each of us had to monitor our grant activities and our work plan activities. There were community-based organizations. There were like 3 or 4 of them, the Urban League of Rhode Island, CHISPA, Young Voices, which used youth and community service to spread the word. So there were a lot of partners, and they were added as we went along.
Okay, great. Thank you. This is for HUD. What is the difference between the old smoke-free housing toolkit and the new one?
The old ones were called toolkits. The new document is not a toolkit. It is a compilation of the results of many, many interviews with housing authorities and owners that have gone smoke-free successfully. It really represents a lot of quotations and a lot of first-hand experience, really highlighting the best practices on what has worked, what the advice that people who have been through this would give to other folks. So it's not really a toolkit, it's more of an action guide. The first 2 toolkits used existing materials and just kind of covered the nuts and bolts. with this second guidance document, we're really going into more detail. And I think it's more user-friendly, and you know, it gets the information right from the horse's mouth, so to speak.
Excellent. Yeah, I look forward to seeing that come out later this year. Okay, another question is it possible to get a sample smoke-free policy?
Sure. I have one in my toolkit, or I can provide it if someone provides me with their email address.
Okay. I will try to connect with the person who asked this question to get that over to you so you can forward it to them after the webinar.
This is Rachel. Some housing authorities have their lease addenda on their website. Sometimes the policy itself is an internal document.
Okay.
But if you want to email me, I will try to find, I mean, I have a couple. I don't know that they're perfect.
And we've been collecting them.
Okay, and Marty Nee says that his staff also has been collecting them, so we should be able to respond to just about anybody that wanted one, I think.
Okay.
Yeah. We'll have to get those emails.
Let us know what state you're from, so we'll get you the appropriate one.
Yeah, that's a good idea. I did want to say that I could send it to you, but I always say keep in mind we're from Rhode Island. It's based around our specific lease as well, so yeah, that's definitely something you need to consider.
Great. Thank you all. And our last question, and this is for Anna. In North Carolina, who was offering or who is offering cessation services was there a campaign to target young smokers in North Carolina?
I am not aware of a campaign to target young smokers in North Carolina, but I also don't specialize in cessation, so that if you want to send me an email and I can investigate that further, but I'm not aware of a specific campaign in North Carolina to target young smokers.
Okay.
If I can, we in Rhode Island did have, the Department of Health actually had a campaign. It was called, the city had one, the city of Providence had one called Sweet Deceit. And it was to make young people aware that the big tobacco companies were, taking them in by providing them with gum and hand sanitizers that had tobacco in it, all these things. It was called Sweet Deceit because you couldn't really differentiate candy with actual tobacco products. And I think the Department of Health had a campaign at the time that had young people that had barcodes on their foreheads and said, you're just a number to the big tobacco. And I just mention it because if somebody's just interested in doing something like that, they could probably Google that in Rhode Island on the Department of Health and the City of Providence.
Great. Oh, thank you. Yeah, I'll try to include that as a resource when I distribute the slides to all of our registrants.
Okay.
So that ends our Q&A portion. And once again, I want to thank each of you for presenting this information for community members to begin pursuing and planning their smoke-free housing policy in ways that they can partner and support the efforts of their local housing authority. So thank you all who attended, and as I said, these slides and resources will be made available to you following the webinar today. Thank you, everyone. You have a good day.
Thank you.
Thank you now.
Bye.
Bye.